Rescue duties. Deciding to provide first aid recognition, asking to provide first aid, supplying the first aid kit. If the person refuses your help, phone your emergency response number or 911 and stay with them until someone with more advanced training arrives and takes over. If the person is confused or cannot answer, assume that he wants you to help. Victim and rescuer safety. Assessing the scene, washing hands, universal precautions, exposure to blood, taking off gloves. Assess the scene, mean consider danger, help, who, where. Wash hands, how long? At least 20 seconds. PPE, personal protection equipment. Examples of PPE. Gloves, eye protection and mask to protect when you give breaths. Veins, ooze. Arteries, squirt. Bloodborne diseases are caused by germs. 3 examples of bloodborne diseases: HIV, hepatitis B, hepatitis C. American Heart Association Adult Chain OF Survival Important Actions. Recognize emergency and phone for help. CPR, emphasis on compressions, rapid AED use, effective advanced care, coordinated care afterward. When to phone for help. Someone is seriously ill or injured, you are not sure what to do in an emergency. Examples of someone seriously ill or injured. AED, automated external defibrillator. Find the problem. Check the scene to be sure it is safe. Tap the person, are you okay? Check if the person is breathing. Look for any obvious signs of injury such as bleeding, broken bones, burns, or bite. Look for medical information. Jewelry. Someone is having breathing problems if breathing very fast or very slow, having trouble with every breath, has noisy breathing, can only make sounds or speak no more than a few words at a time in between breaths, although person tries to say more. Choking. When food or another object gets stuck in the airway in the throat, the object stops air from getting to the lungs. The choking sign, holding the neck with one or both hands. Heimlich Maneuver. An emergency procedure to help someone who is choking because food is lodged in the trachea. Where to position your hands for the Heimlich Maneuver. Signs of a heart attack. Chest discomfort, squeezing, pressure, fullness or pain, discomfort in other areas of the upper body, pain or discomfort in one or both arms, the back, neck, jaw, or abdomen, shortness of breath. Other signs may cold sweat, nausea, or lightheadedness. Signs of a heart attack in women, the elderly and diabetics. Ache in the chest, heartburn or indigestion, uncomfortable feeling in back, jaw, neck or shoulder. They may also complain of shortness of breath or have nausea or vomiting. Fainting is a short period when a person stops responding for less than a minute and then seems fine. Not enough blood going to the brain. Seconds before fainting, may feel dizzy. Fainting often occurs when stands without moving for a long time. Is hot weather, has a heart condition, suddenly stands after squatting or bending down, receives bad news. Low blood sugar can occur when not eaten or is vomiting, not eaten enough food for the level of activity, injected too much insulin. Signs of low blood sugar. Change in behavior, confusion or irritability, sleepiness or not responding, hunger, thirst or weakness, sweating, pale skin color. Seizure. Stroke occurs when blood stops flowing to a part of the brain. Signs are usually very sudden. Signs of a stroke. Sudden numbness or weakness of face, arm or leg on one side of the body, sudden confusion, trouble speaking or trouble understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, sudden severe headache with no known cause. Seizure, abnormal electrical activity in the brain. Seizures can be caused by a condition called epilepsy, head injury, low blood sugar, heat-related injury, poisons. Shock. Shock develops when there is not enough blood flowing to the cells of the body. Shock is most often present when loses a lot of blood that you may or may not be able to see, has a severe heart attack, has a severe allergic reaction. Signs of shock: feel weak, faint or dizzy, feel nauseous or thirsty, have pale or grayish skin, act restless, agitated or confused, be cold, clammy to the touch.